Skull at birth. Structure at adult size at birth. Structures not at adult size at birth. Structure at adults at birth. Tympanic membrane, tympanic cavity, ear ossicles, malleus incus stapes, tympanic, mastoid antrum, internal ear, cochlea, vestibule, semicircular canals. Structures not at adult size at birth. Tegment tympani, roof of middle ear cavity, mastoid process, appears after birth of baby, external ear and external auditory canal, eustachian tube, orbit. Development of the nervous system. Nervous system develops from the neural plate ectoderm. At the dorsum of baby, a plate develops called the neural plate. Neural plate develops to form a neural groove and later neural tube. Two neural pores are formed. Cranial rostral neuropore closes at day 25, leading to the formation of brain. Caudal posterior neuropore closes at day 28, leading to the formation of spinal cord. Neural plate starts to form from the central ectoderm after stimulation by underlying notochord. The neural plate ectoderm further develops to form a neural groove. This neural groove finally detaches from the dorsal surface and forms the neural tube. This neural tube forms the brain and spinal cord, central nervous system or CNS. Neural crest cells. The peripheral nervous system is formed by NCCs. NCCs are formed at junction of neural plate ectoderm and surface ectoderm. NCCs also detach from themselves from dorsal surface and come to lie dorsolaterally to the neural tube. Most of the ganglia are formed by neural crest cells. Important information. Non-closure of anterior neuropore leads to anencephaly. Non-closure of posterior neuropore leads to rachis. Open neural tube defects. Anencephaly. It occurs due to non-closure of anterior neuropore. Brain is small and degenerated without the skull cap. Rachis. It occurs due to non-closure of posterior neuropore. Defect in lumbosacral region. Vertebra has not fused. Spine is bifid. Skin is missing over the defect. There is leakage of CSF. Important information. Open neural tube defects can be prevented by giving folic acid prophylaxis 400 mg per day to pregnant females prenatally and postnatally. Craniorachis. It occurs when there is total non-closure of neural tube. Therefore, this combination of anencephaly and rachis. Types of spina bifida. Spina bifida occulta. It is the most common type. It is an asymptomatic condition which is found incidentally. It is not evident clinically. Patient might have a tuft of hair in lumbosacral region, but nothing more evident. However, deep to that there is bifid spine. Although the spine and meninges are within the limits of vertebrae, spina bifida with rachis. It is the least common type. It occurs due to non-closure of posterior neuropore in the lumbosacral region. Defect in lumbosacral region. Vertebra has not fused. Spine is bifid. Skin is missing over the defect. There is leakage of CSF. Spina bifida cystica with meningocele. A cyst is seen in the lumbosacral region which only has protrusion of meninges. Spine is still present within limits of vertebrae. It is covered by the skin. Spina bifida cystica with meningomyelocele. A cyst is seen in lumbosacral region which has protrusion of meninges and some neural tissue. Spine has come outside to lie in the cyst. It is covered by the skin. Important information. Spina bifida cystica is also known as spina bifida manifesta.